Hi guys, so welcome back. Thank you so much for being here. It's so greatly appreciated. It truly is. Before we start, my usual disclaimer. This video is for educational purposes only. There may be pictures that some may consider triggering, so just keep that in mind before moving forward. Please do not take what I say as fact. Please always do your own research. Along with this, please keep in mind that this is a very triggering topic for a lot of people. So please keep the comments respectful. Please no victim shaming. That's not who we are. And with that, let's get started, okay? With most insurance companies seeing plastic surgery as cosmetic, they typically refuse to foot the bill for it, okay? So this would end up sparking a new trend, having plastic surgery abroad. And I totally get why. Okay, it's become so popular that overseas cosmetic surgeon practices have partnered with specialized travel agents to create vacation packages that include the surgery that you're seeking. Okay, so a typical package would include your choice of operation or operations at a fraction of the cost, tour itineraries, resorts, and spas. The Society of Aesthetic Plastic Surgery has certified over 1,500 surgeons in 73 countries that meet the criteria required in the US, which is amazing, right? The only problem is that that leaves a huge pool of surgeons who do not meet the criteria that the United States requires. This does not always mean that they're practicing illegally. Different countries have different rules. Even the United States doesn't have guidelines as strict as surgeons. So an OBGYN, an optometrist, and a dentist can all take the same test that a plastic surgeon can take to get a license. But to be fair, not all botched surgeries are abroad. It can happen. It can and has happened in the United States numerous times. Recovering abroad. So, recovering abroad is sometimes what leads to the worst complications. For starters, when the travel agent booked your vacation surgery trip, they forgot to tell you that swimming, drinking, and sunbathing can actually slow down the healing process. It is also not recommended to fly for at least 10 days after your surgery, and recovery may require several weeks. Along with this, if something does go wrong with your surgery abroad, plastic surgeons in the United States may not be able to help you or may not want to help you for fear of lawsuits and malpractice claims. Get that. I totally get that. If you do find a surgeon in the United States that will help you, it will most likely cost more than if you had just had the surgery done in the United States to begin with. Okay, so before moving on, let me say again that there may be pictures or details that could be triggering to some, so please keep that in mind. 38-year-old Lindsay. She is an insurance underwriter from Florida. She decided to travel to Colombia to have a tummy tuck as a treat for herself for her upcoming 40th birthday. Lindsay spoke to the Daily Mail in 2019, where she shared that she had a tummy tuck back in 2012 in the United States and that she wasn't really happy with the result. So she decided to have corrective surgery and a butt lift. She picked Colombia because a girlfriend of hers had a surgery in Colombia and she had a very positive experience with it and she loved the results. When she arrived at the clinic in Colombia, doctors advised Lindsay to do a breast lift and reduction as well. And although that wasn't part of her original plan, Lindsay decided to go for it. Go big or go home, I guess, right? So Lindsay says that when she woke up from surgery, her legs felt numb and she was vomiting uncontrollably. This would continue for several days. Along with this, Lindsay would begin seeing a black spot under her bandage. When she questioned it, the doctors told her that that was just dried skin and not to worry about it. So Lindsay had originally planned to stay in Colombia for 20 days, but she was forced to stay an extra 2 weeks because of all the complications that she had. She goes on to say she had open wounds on her breast because the incision was not big enough for the implant. So doctors put a double D implant into a C cup incision, and her skin began to break open. She got a fever, and she continued to show signs of infection. And she was encouraged to walk around, even though people are advised to rest post surgery. After this, her stomach began to fill with fluid, and pus would seep out of her belly button. The clinic sent massage therapists to her hotel room with razor blades to cut open the incision and massage the fluids out. Along with this, okay, it's important to remember that this is very unsanitary because number one, hotel rooms are not sterile environments. And along with this, massage oil is not good at all near open wounds. But Lindsay said that she ignored the red flags because she just wanted to feel better. And if I'm being honest, I can understand where she may have been coming from. I can. Because when you think about it, she's alone in a foreign country. She's in a lot of pain. And I think any of us would ignore the little voice in our heads if we thought that, this may ease the excruciating pain that we're in. After Lindsay returns to the United States, her first stop is the hospital. And thank God that it was. Because after getting checked out by reputable doctors, Lindsay was told that she had contracted E. coli in her breast and she needed revision surgery on her stomach. I hope I'm pronouncing this right. Necrotizing fasciitis, more commonly known as flesh-eating disease, is rare but extremely vicious bacterial infection. The disease develops when bacteria enters the body, typically through a cut or a scrape. And as the bacteria multiplies, it releases toxins that kill tissue and cut off blood flow to the area. And it spreads very rapidly. Symptoms include small red lumps or bumps, rapidly spreading bruising, sweating, chills, fever, and nausea. Patients may undergo skin grafts after the infection has cleared up to help the healing process. There are approximately 500 to 1,500 cases reported each year, and 20 to 25% of the victims will not survive this. Lindsay would have to undergo 2 more surgeries to install 3 drains to flush out the infections in her stomach. So she now has a $40,000 medical bill for her corrective surgery in the United States. That's not including what she lost from her surgery abroad. And if she would have done the surgery in the United States to begin with, it would have cost her $35,000. So I think it's safe to say that she has learned and grown from this horrible experience. And her goal now is to share her story on social media and to educate others, which is, I think that's a wonderful thing. It's a way, what a great way to turn a huge negative into a positive. And if she stops at least one girl from rushing into plastic surgery abroad, then she's done her job and she's done it well. Okay, that was a lot, but that is actually only the beginning of this huge rabbit hole that we are about to go down together. 53-year-old Beatrice is a truck driver from Montana and a mother to a 28-year-old daughter who at one time weighed over 182 pounds and was very self-conscious. She decided to get liposuction on her legs, stomach, and back to boost her confidence. Okay. I get it. I totally get it. She would end up choosing Colombia because after researching the surgery that she wanted, Colombia seemed to be the country that specialized in what she was looking for. And they had very reasonable prices. So she would watch a bunch of videos on YouTube and she felt confident that she knew what she was getting into. But she would be so, so, so very wrong. Beatrice would say that while she was under, they literally cut the fat off of her stomach and then stitched her back up. The surgeon would try to fix his mistake by attempting to use skin from her back and pull it forward, but it was unsuccessful. So Beatrice believes that poor hygiene played a major role in the infection starting. I think we can all agree on that. Beatrice would say that the nurses who were in charge of her post-surgery care would use the same gloves that they were wearing to care for her to text on their cell phones. There was no plastic wrapping over the surgery or a bodysuit to protect it. And by the second day, the skin was red and inflamed, and you could visibly see the skin beginning to die. The skin would then begin to turn black and die. Beatrice says that she was on so much pain medication that she couldn't feel anything, but she knew that something was terribly wrong. The hospital tried to oxygenate the skin, but it had turned completely black. So she was forced to undergo another surgery in Colombia to fix the gaping hole that was left behind by the dead skin. She would tell the Daily Mail she spent most of her recovery crying, and it has destroyed her confidence and has been absolute torture. So her goal now is to find the surgeon that did this to her, because he currently has 34 cases against him and he's essentially missing in action. In August of 2020, 47-year-old mother of one, elementary school teacher Michelle Williams decided to undergo what should be a very simple rhinoplasty, a nose job, in Turkey. But the surgery did not go as planned, and Michelle suffered major complications, and she's actually been left in a permanent vegetative state from it. After a few months in Turkey, Michelle returned to the UK on a private ambulance flight. Prior to this, Michelle was described as outgoing, funny, family-oriented, and a lover of life. Now, she's unable to walk or do anything for herself. The specifics of what happened to Michelle during her surgery remain unclear, but her family has filed a legal case against everyone involved in her medical care. The lawyer that took on Michelle's case said that it's very difficult for a foreigner to file a case in Turkey for medical negligence, saying that it could take up to 2 years in a Turkish court to prove a negligence claim, and it's very hard to prove medical negligence, especially if the person does not have the right documentation and if they book their surgery through a package deal. So remember that, guys, in case you decide to do this. These bundles, the package deal bundles, that they will typically include flight, accommodation, and surgery. Another issue is that most of the time, the patients are asked to pay in cash and sign a waiver. So these waivers go far beyond the complications that any operation can have. Essentially, you are literally signing your rights away when you sign these waivers. Please remember that also. 40-year-old bodybuilder Michelle Heath from Northern Ireland had lost upwards of 140 pounds. As a result of this achievement, she was left with a lot of sagging skin. That's actually very common. So after years of tucking her sagging skin into like underwear, shapewear, she decided to go to Turkey and treat herself to liposuction. She paid 4,000 euros for a package that included a leg and back lift, flight, and 5-night stay in Turkey. She would return to Ireland with open wounds and required 2 more surgeries with skin grafts. Michelle would also say that liposuction and a Brazilian butt lift was done without her permission. Without her permission. And she did not know that it was done until the 3rd day of her recovery. So can you imagine, this girl is in a foreign country, She's under. She has no idea what's going on. They botch the liposuction on her. Then they give her a Brazilian butt lift, and they don't tell her until 3 days later. I'm pissed. I'd raise some hell. After realizing that she was not getting the proper care, she returned home and she went straight to the hospital after her wound opened up. Her legs had developed necrosis, which is the death of cells in an organ due to disease, injury, or loss of blood supply, and she needed surgery and skin grafts immediately. 28-year-old Holly. She flew from Manchester to Istanbul, Turkey for breast implants after seeing an ad on Instagram that were reassured by the celebrities that were promoting them. She paid 2,700 euros for her operation and a 5-day stay in an all-inclusive villa. 5 foot 6 inch, size 8 Holly told the doctor that she wanted G cups. Which, oh, girl, it's kind of big. To which the doctor responded with a high five and no further questions. Which I think that would be my first red flag when the doctor high fives me. Holly would say that she was very anxious about it, especially because she hadn't actually seen the implant before the surgery. But she said that she had made her decision and she was going to follow through with it. I get that she made her decision. I get that she wanted to follow through with it. But moving forward, in hindsight, I'm sure she's like, why didn't I ask more questions? Because at the end of the day, she was more excited than anything else. She says that 4 hours later, she was being wheeled into the operating room, and the last thing she remembers is the doctor telling her, "You wake up with big boobies." But Holly says she woke up in pure agony. She would say that each time the nurse touched her, it felt like her chest was on fire. She typed into her translator, "I can't take it anymore." She says that's when they wheeled her back into the operating room, and when she woke up, the implants were gone. But she was left with stretched out skin from huge implants that were loose and saggy looking. So she said that the doctor blamed her for wanting such big implants. Regardless, as a medical professional, isn't it your job to say, no, I don't think that you should do this, or refuse to give such a tiny girl such big implants? Right? I don't know. I'm asking. But the doctor blamed her for wanting such big implants. So he told her to go home and heal before coming back for free replacement implants. She went home and she would heal for 5 months before flying back to Istanbul for her free replacement surgery. She said this time she got a D cup, which was more appropriate for her tiny frame, and she said that she was feeling satisfied after the surgery as it was what she had expected. So things seem to be going great until the next day. Holly begins to have cold sweats and a high fever. 2 days later, she's on her way home. So she's flying home, and she would tell the magazine The Mirror that during the flight, she fell on her bubs after feeling nauseous and leaning forward to vomit. She says that she screamed out in pain, comparing the feeling to being hit by a car. She was taken to a medical room in the Amsterdam airport while she was waiting for connecting flights. The doctors there told her that she had an infection, and they gave her antibiotics and painkillers and cooling gel before her flight home. Once she landed in Manchester, she was rushed to the hospital. From there, she says, there was a large blister along the incision mark of her left breast. She was given antibiotics and she was sent home to recover. The blister caused the skin around it to turn black, and Holly was rushed back to the hospital. The doctor there told her that the black hole was dead skin. She says that this was the first time somebody had told her that. she was discharged and assured that the skin would grow back together. But while she was home recovering, the hole started to smell like rotten meat and it was discharging a yellow liquid. Along with this, she noticed that the left implant was poking out. Can you imagine this? Like, can you imagine this? Oh, she had to be freaking out. I'm freaking out for her. She had to be freaking out. She was rushed back to the hospital and told that there was a 7 centimeter hole. She was transferred to a hospital that had a plastic surgeon who specialized in this, and he suggested that the implant be removed. She asked what the alternatives were, and she was told that if she didn't have the implant removed, that she would end up dying. It would end up killing her. She says that she sobbed and sobbed, but ultimately she knew what she had to do. She was discharged 5 days later, again with painkillers and antibiotics. And now she had to go back under the knife again to fix her mismatched breasts. Okay. To be fair, because I know that we're dogging out plastic surgery abroad, there are people that have been gracious enough to share their stories of plastic surgery nightmares that actually happened here in the United States. So in August of 2021, 28-year-old Paige, who is a nurse practitioner from Arkansas, visited a beauty practitioner close to her home to have lip fillers injected into her top lip for the first time ever because she wanted to enhance her natural pout. But just days later, the tissue in her lip would begin to turn black and die. Paige says that while the cosmetologist was administering the filler, she was met with resistance and a white spot formed on the skin. Paige goes on to say that she now knows the white spot is a telltale sign of vascular occlusion. What is vascular occlusion, right? Vascular occlusion occurs if a filler is inadvertently injected into an artery or if enough filler is injected around an artery or blood vessel to cause a compression blockage. Although vascular occlusion during dermal filler treatment is rare, it is a serious complication that can quickly lead to tissue necrosis if it is not identified and treated promptly. So, please be careful with lip fillers, guys. Paige says that immediately after her lip filler appointment, she suffered intense pain, swelling, and along with noticing that the right side of her top lip began to look very pale. She says that same day, her lips were super painful and that she could hardly talk. She messaged the cosmetologist about it several times and she told her that it was normal and that she just needed to massage them. So, since this is Paige's first time, I guess she didn't know what to expect. So, of course, you're going to believe your cosmetologist, right? But thankfully, 2 days later, she decided to go to urgent care. The doctor there gave her a steroid injection, hoping that it would reduce the swelling and restore the blood flow. But the following day, when her symptoms persisted, she was given another steroid injection and prescribed antibiotics and antibiotic cream due to a concern that her lips had been infected. 5 days later, a doctor finally confirmed that the filler was likely injected into her vein and was starving her lip of oxygen. To restore the blood flow and save her lip, Paige underwent treatment in a hyperbaric chamber to restore blood flow. She would do this treatment for 10 hours, split up into 5 sessions, to see if the blood supply could restore around the filler. Unfortunately, this didn't work, and the pressure from the chamber actually dislodged the filler, further cutting off blood supply to her nose and chin, meaning she had to have the filler dissolved immediately, or she would risk losing half of her face. Can you imagine this? This girl had to be freaking out. She had to be petrified. Paige went to have it dissolved immediately, and they ended up having to do a dental block on her because the pain was so intense that she was shaking and she feared that she would pass out from it. Thankfully, this treatment worked and it restored blood flow back to Paige's lips, saving her face. But this traumatizing experience left her with a $6,000 doctor bill and pissed off that the cosmetologist refused to take any responsibility for her mistake. She blamed Paige for the complications, saying that Paige failed to follow the aftercare instructions and got a steroid shot before giving the injections time to settle. I don't know if this is true or not. If you're a cosmetologist, let me know. If you're a cosmetologist, or if you've had this done, let me know in the comments if this cosmetologist is correcting what she's saying, or if she effed up and she's trying to get out of taking any blame for it. Paige would say that the scabs came off after about 3 weeks, but she still has a lumpy scar tissue in her lip. Paige says that she fears that the next person that she does this to may not know the signs, and there's no telling what could happen to them. In 2009, 47-year-old Carol of South Florida decided to try fillers into her face to fix what doctors had described as lost volume in her forehead and cheekbones, okay? More than 15 million people in the United States undergo some sort of invasive cosmetic procedure each year, from injectable fillers to breast implants. In Carol's case, 2 different fillers, including one that was silicone, were combined in the same syringe and injected into Carol's face, in an area that should never have been injected. Carol would tell The Independent that 3 months after the surgery, she was horrified by what she saw. She would undergo corrective surgery, but this would only end up making a bad situation worse. The first surgery to debulk her forehead affected her optic nerve, and it caused her to permanently lose sight in her right eye. Saying, "My face began to swell and contract to the point where not only did I have to hide from my family and friends, I actually had to hide from myself, never looking in the mirror." She would go on to say, "I felt like I had the head of an alien. My forehead was so heavy that it fell and covered my eyes, so that I could not see unless I taped or held up my forehead." For 3 years, Carol separated herself from family and friends, refusing to leave her house, locking herself in her bedroom, and even contemplating unaliving herself at times. Eventually, thankfully, her daughter would intervene and force Carol to seek help. So, the mom and daughter moved from Florida to Los Angeles to begin her recovery journey. For years, Carol would have to undergo corrective surgeries, one more painful than the previous. But she says the most painful surgery was a 17-hour skin graft surgery where doctors took skin from her back and put it onto her forehead. Today, Carol looks great, but it was a long and painful journey to get there. She's now the head of the Saving Face initiative, face2facehealing.org, which raises awareness of disfigurements. I would go on to tell The Independent that she wouldn't change what happened to her, regardless of how much she suffered, because it gave her a new and worthy calling. As the popularity of cosmetic surgeries continue to rise, Carol is calling for stricter regulations for practitioners and encourages others to carefully consider why they want cosmetic treatments. Okay, guys, I'm going to end this video here because I think it's starting to get kind of long. But I'm thinking of doing a part 2 if you guys are interested. Only if you guys are interested. Because there are actually so many more people that have come forward and shared their horror stories. So let me know if you guys are interested in that. If you have not liked, subscribed, or commented yet, please do so. It would be so greatly appreciated. It really, really helps me out. Before I go, remember that you're beautiful. Remember that you're enough. You are enough. If you do decide that you want to go and do a surgery, go for it. I say go for it. Just make sure you really, really research and know what you're getting into before you get into it, please. And until next time, guys.